Hi, Dr. Lewis here, the Health Revival Partners, looking at some case studies. Let's look at case study number 1. And what we have is just a headache, think again. Chronic headaches and neurodegenerative diseases. So a headache and a migraine, for example, are actually an energy crisis in the brain. And if your brain cells, neurons, are in an energy crisis, it can lead to degenerative conditions. I'm going to show you with this particular case how we're showing that is a high probability for this individual. So we're talking about a 42-year-old executive assistant, has had daily headaches since her teen years, so over 20 years, headaches every morning. So every single day she says she wakes up with a headache, really a migraine, a very severe headache. And she's taking 4 daily medications per the standard of care, per various doctors she's seen. Excedrin, beta blockers, some pretty aggressive pharmacological agents just to get her through the day. So she's had multiple visits to various neurologists, routine testing, scanning, MRIs of the brain, and they found nothing over the past 25 years of trying to help this lady solve this headache conundrum. But symptom management with the pain medications does not create health. It's not the right solution anyway. So that's a fail. Standard of care is a fail, unfortunately. So we came in and she joined our program. She worked in a corporation, and we ran our root cause diagnostics, what we call determinants of health, sophisticated HRA, health risk assessment. And we found that, in the area of brain health, she indicated she has headaches and migraines, and that this is an everyday occurrence. She's been bitten by mosquitoes, but she's also been bitten by a tick or ticks. And she says that basically the headaches and memory issues impact her every day, or every single day is affected by this. Interestingly, with most people who have chronic conditions, even though she appears quite young and healthy, is that she has comorbidities, different disease conditions overlapping with her headaches. So pain, depression, anxiety, stomach conditions as well. And then she has diagnosed low thyroid activity, and she's seen some sudden weight loss changes or weight gain changes. So we dug down after doing some blood work, our Dimension 2, we call our chronic disease temperature, and had some suspicions about what was going on with her. So we went to a second level of root cause diagnostics, looking at stealth infections, viruses, and bacteria. And so we can see here that she is positive for herpes simplex virus, and at a pretty high level. The next thing is we found that she has the parasite that gets inside cells called Toxoplasma gondii. We see antibodies fairly high, and this is the one they warn to-be and pregnant women to avoid cat litter, because that's one source for the Toxoplasma gondii infection. And the next, chlamydia pneumoniae, it's not the STD, that's the STD. She was negative for that. But for the chlamydia pneumoniae, which is a respiratory pathogen that really will spread and infect small vessels, your endothelial, the vessel linings. So she's positive for that. Mycoplasma is walking pneumonia, gets into the respiratory, can affect the brain as well. And then we did a Lyme screening for both IgG and IgM, and she was positive for both the acute and chronic phase of Lyme disease. And recall in our survey, she's indicated that she had been bitten by a tick, which is a very good, reliable source unfortunately, for Lyme. It's called a vector. So not every tick carries the Lyme bacteria, but in this case, it appears that she was infected by a tick that was a carrier. So what does Lyme have to do with anything? Well, here's from Healthy Women website, and we see that there is a connection between migraines and Lyme disease. Lyme disease will affect a lot of different tissue, but it will affect blood vessels. And your brain is very metabolic, meaning there's a lot of blood flow for a small amount of tissue. So anything going on in your bloodstream may have, or will have a profound effect on brain function. Anything from a little brain fog to difficulty focusing to dementia. So all those are in play. So why do chronic headaches matter? So migraines, can dementia, stroke, or heart attack be next? And what this study says is after high blood pressure, migraines with aura was the second strongest single contributor to the risk of heart attacks and stroke. So severe headaches, and obviously someone is having them every day, fits into that category. And this is from Harvard Medical School is publishing and discussing this connection. So we don't know for sure, but is this the person with the migraines that's likely to be an early dementia sufferer? We don't know, but it's there's certainly a strong connection there. And Dr. Trump and myself, Dr. Trump from Harvard and I wrote a paper on all the risk factors that may lead to dementia or Alzheimer's, and depression and migraines are on that continuum. So more importantly, the reason why we have to solve this, not just manage the condition, is because migraines may permanently change brain structure. The risk for infarct-like abnormalities increased by 44% for those with the migraine with aura compared with those without. Now, what is an infarct-like abnormality? It's probably what we call a microinfarct. So what we're really talking about is a mini stroke. So you can see how we're talking about an energy crisis, the blood vessels and vasculature supplying the brain, and we have some of this being cut off by these small mini strokes that sometimes you don't even know are occurring. And this is from the American Academy of Neurology. So why do headaches matter? Increased risk of multiple sclerosis among women with migraine. This is the Nurses' Health Study. 68,000 women involved, so a history of migraine was associated with an increased risk of multiple sclerosis. So we're seeing stroke, MS, potential dementia, tied back to migraine. So it's all happening in the brain along a likely continuum. And this is from the Multiple Sclerosis Journal. So why do headaches matter? Well, let's look at Toxoplasma gondii. That was one of the things that she was positive for. Is it a causal agent in migraine? So the results of this study show the presence of chronic toxoplasma infection in patients with migraine. So toxoplasma infection may contribute to neurogenic inflammation as a pathogenesis of migraines, causal factor to it, an underlying reason why the migraine is existing. So neurogenic, neurological inflammation. So, and as you recall, this young lady was positive for toxoplasma antibodies, inferring that she is infected with toxoplasmosis or Toxoplasma gondii, parasitic intracellular infection. Now, even though MRI and a lot of other analyses through neurologists revealed nothing going on with this young lady in terms of a neurological or neurodegenerative condition, we had her referred out to an optometrist to get what's called an optical coherence tomography scan. And OCT is similar to MRI, but we measure tissue three-dimensionally in the back of the eye. Now, OCT happens to be much more precise and accurate than MRI. I won't get into that now, but it's the type of light that OCT uses. So the take-home thought here is that the OCT can see much finer detail than can MRI. So what we're seeing, here's thickness of the retina, so the neurological tissue in the back of the eye, and we can see that she's really not in a healthy range. She has some level of thinning and actually is going into an area that would be classified in the standard of care as degenerative. So we're seeing this degeneration, and it shows up in what's called the clock hours, where we're seeing that she has thinning in this portion of a quadrant along her nerve layer that transmits light signals to the brain when we're exercising our eyesight. So this is a sign of optic nerve degeneration, and the optic nerve is really an outcropping of the brain. Embryologically, the retina is an outcropping of the brain. It's tied to the hippocampus primarily, but it's more broad than that. So here's a study that the cup-to-disc ratio is abnormal in multiple sclerosis and correlates with visual function. That's what we're seeing in the OCT. We're seeing a deterioration in the optic nerve, and that OCT can measure really objectively the progression or hopefully regression of therapies or just the degeneration of nervous tissue in the brain through the surrogate of the eye using optical coherence tomography. So we really are getting a really early view, non-invasively and inexpensively, into her neurological conditions. So here's another one from the journal Eye, from the Scientific Journal of the Royal College of Ophthalmologists, Multiple Sclerosis and Optic Nerve, analysis of retinal nerve fiber layer thickness, which we did, and color Doppler imaging parameters, which is the technique we didn't do in this case, but in multiple sclerosis patients, diminished retinal nerve fiber layer thickness, which we observed, is seen. So she may have been or is on the path towards multiple sclerosis without an intervention. So this is what our program did, Health Revival Partners Root Cause Health Revival Plan. So root cause diagnosis, assess the eye for signs of brain neurodegeneration, run our in-depth chronic disease temperature 55 biomarker algorithm to assess where she is on the physiological risk scale, do an in-depth infectious assessment, which we showed you some of that data, assess food sensitivities, very common, especially with someone who's reporting thyroid issues. So that's a comorbidity. We create a personalized health revival coaching plan, nutrient density for the diet, no specific thing, but nutrient density and anti-inflammatory. So those would be omega-3 and marine oils. Address vitamin and mineral deficiencies based on existing diet. Do an elimination diet to try to get rid of things that may be offending the health of the gut and leading to the thyroid resistance syndrome she had. So more gut health support and optimized kidney function, which she was low in kidney function because of years and years and years of taking aggressive anti-inflammatory drugs, NSAIDs, that really harm the kidney. So that's a big part of the program. Then the treatment of previously undetected intracellular infection. So we completed a 9-month program with this lady, and this is what she said. She feels blessed that she was able to be part of the HRP program. Her main goal was reducing her daily headaches. She was able to stop within the first 6 months taking 2 of the medications, and she was taking daily for headaches. There were several days she'd gone without a headache. It's been years since that has happened. And she's also had a reduced frequency of migraine attacks. And she says has more energy and feels better than she has in a long time. And just as a sidebar, she said, when others around me come down with a cold or flu, I've been able to stay healthy, which was not something that she was able to do in the past. So we continue to work with her to treat these intracellular pathogens, which we believe are primarily causal, and also her overall immune and health status to help her own body fight these infections. And she is continuing to make great progress. So Dr. Lewis here, Health Revival Partners, case 1, when a headache isn't just a headache, and we can see that severe headaches like this have downstream consequences if not arrested at a root cause. Thank you very much for your time.